week. Yeah,
Been good.
so we'll have a small group tonight, huh?
Yeah, I think so. That's what I guess we will be shy, won't we?
Yeah, that's okay. That's all right. I like a small group.
Yeah,
Seems like people share more.
yeah, that's right.
I don't know, I go to join the meeting and it's
Yeah,
awesome.
it's kind of nice out outside. I was kind of enjoying, I grabbed a sandwich on the way here and I kind of just sat there in the sun and enjoyed it.
How was your Easter?
What?
Yeah,
You know?
did you have kids?
No, we had our
8, 5,
son came by a little bit.
Grab some.
Day before.
Oh, okay.
Yeah. It's good to see him.
Yeah, you probably don't get to see them enough
Yeah,
distance.
yeah. So it was good.
I had a full house,
Good.
lots of cooking and cleaning and it was fun though.
Oh, good. That's great. It was kind of easy. We actually went over, one of our friends invited us over. They had a bunch of little kids around and they had set up an Easter egg hunt
Oh,
for them. So
yeah.
we went over and watched that. Kids were just,
I know they love that.
oh, that was fun to watch.
So the two grandkids that usually come are 13 and 15 now.
Mhm.
So Randy always makes a scavenger hunt or something for them,
Oh,
no matter how old they are, but he's been gone.
uh-huh.
So I made baskets for him and hid him and I told him, sorry to disappoint, but it was pretty cute.
Very good.
So instead of eggs, one of them's into baseball, and one's into golf.
Uh-huh.
So I filled the baskets with candy and stuff, but baseballs and. golf
Oh,
balls
very
and
good.
I thought that was pretty funny.
Yeah. Very good.
Uh,
Crazy. I wound up with, I just couldn't shake a cold last week.
Oh, yeah.
And, so I went into the doctor and they checked me for everything and they said, don't have COVID. It's not the flu. You just got some kind of a
Upper respiratory.
thing.
They predicted that.
Didn't
Did you
work?
know that?
Yeah, is that
Yeah,
right?
they
So you get me in
predicted
here.
it.
You'll have
Oh,
to
yeah.
take me on my best behavior.
So you know,
I'm just not here.
that's where I had it. It ended up turning into pneumonia, but it was right here, upper
Really?
bronchial tubes.
Well, I'm finally kind of starting to shake it, but boy, man, it
It's-
kind of knocked me down for a couple
Uh-huh.
days.
Yeah.
I would come in for a meeting and then go home and rest.
Oh, wow. Yeah, I had to do that as well. I was tired.
Where is she's in?
Yeah, it kind of lingered for a while and I think I'm over it. I'm not coughing up stuff anymore.
Mhm.
But man, it's hung around for 3 weeks.
Hmm.
Hi all.
Well, I was kind of feeling optimistic that
Hello
maybe I
there.
was going to be done with it this weekend, so I don't know.
Oh, way to put a time on it. So for
Yeah.
sure it won't.
Yeah, that's right.
You can pull up the sheet. We have them, word packet and all that.
I have the board, the whole packet.
Okay.
So, okay, I'll throw that up on the screen and we'll go through.
How are you?
Fine. You'll see the sheet. So if you don't mind saying.
Mhm.
Brenda.
Oh, she's out of town.
Does anyone need an updated packet?
I would just take the budget sheets.
Just the budget sheets.
I might need one so I got one in the mail and then I printed off the budget.
Did the
That was
agenda
just in
change?
case. The agenda did not
Okay,
change, just that we were able to add the fiscal year 26 budget sheets in that we didn't originally have in the packet.
Okay, cool.
So I actually have 2 copies, so.
And you have.
Yep, I printed it.
I was kind of surprised at our last meeting that nobody was aware of these non-lethal means of self-defense.
I
I
saw that.
thought I just went online and made some copies. I was surprised. And I just left some information on it down with the folks at the suicide prevention group. If anybody wants it,
It's a great idea.
for those who feel like they need to defend their family, I think maybe this is a safer way to do it than with a pistol in the nightstand, you know?
I would agree.
There's quite a variety of options there, but it shows you how you can get it with pepper spray and all that sort of stuff. So
Yeah. Thank you for that.
Sandy, for the training, I will need to share my screen. Would you give me permission to share?
Okay, it came up and it asked me and I said yes.
Oh.
Do you think I need to do something else?
Nope, I got it. Thank you so much.
Perfect. Yes. I will just throw it out there. This is my first board meeting of trying to run the electronics. So if I'm a little bumpy, I thank you for your patience in advance.
Thanks for going for it.
Sandy, would you like to make me a co-host just in case?
I thought I did. With me. Go. I think if you go down to participants, maybe. I don't know.
How much time do you have left?
June is the last one for me.
Okay.
I
Two.
did that.
Yeah.
Didn't work.
Excited about that?
I'm ready to, I think it's time.
Move on.
Yeah. No, public health is in my blood, so. I don't know that I'll ever move on, but no, I'm ready to make way.
Yeah.
Yeah. We need to find somebody. Be nice to have another person with.
All the new people.
Yeah,
We could introduce
history.
ourselves. These are all new people I've never met.
Yes. Non-lethal. Self-defense.
Sandy, this is our new minute structure, huh?
Yes, ma'am.
Yeah, it's kind of fun.
Yeah, that's something different.
Mm-hmm.
Sir, I believe you are now officially a co-host.
Perfect. I think I am too. Thank you.
Thank you. At least we're all enjoying some sunshine today.
Although it just got cold.
Did it?
The wind
When I walked outside, I was like, oh, come on. It's never ending.
So, can we introduce, because I don't know any of these people.
Yeah, let's do it. Yeah, I'll go ahead and open the meeting. It's 1:00.
Already signed.
And we will start though with the introduction, and then we'll get into the agenda. So
Yeah.
I'll start. My name is Bree McLaurin. I'm the chair of the Board of Health. And as Sherry reminded me, or not, I've been on the board about almost 6 years now. So the last two meetings coming up will be the end of my time with this position. So it's been a good long road. Yeah, I worked for the health department 7 years, several years back too. So I have a long history here.
So I'm Sherry O's Mosley, and I've only been on for several months. And I'm a board member at large, just for the community. Really enjoying it.
I'm Melinda Reed from Helena City Commission, and I think I was put on, this is my third or fourth meeting.
Mhm.
Over to you.
I'm Tom Rolfe from the County Commission.
Hello, Madam Chair, you're the chair.
Yes.
Okay, Madam Chair, members of the board, my name is Haley Brotke. I am the new home visitor, universal home visitor, as well as the WIC breastfeeding peer counselor. And I'm really excited for the opportunity and excited to meet you guys.
Same.
My name is Jordan Koenig, and I am the billing clerk upstairs in public health. I'm glad to be here.
Right on.
I'm Lisa Kaufman, board member in my second term as well, so a couple of years yet.
Nice to see you in person.
Yeah, I made it.
Yeah, you did. Fantastic. You want to finish the table and then I'll go online?
Yep, I am Sandy Winnington, Public Health.
I am Heather Baker Palmer. I am the finance coordinator for public health.
Great, thank you. Okay, Rex.
Good afternoon, Rex Welts. I do not have video today, but Superintendent Helena Public Schools, and I believe this is going on a little over 4 years.
Thanks, Rex.
bet.
Let's see. Brenda, we all know who you are.
Yeah, good afternoon.
Sarah.
Good afternoon, Madam Chair, members of the board. I'm Sarah Sandow, the Community Health Promotion Division Administrator at Lewis and Clark Public Health.
Thanks for being here. Shannon.
Good afternoon. I'm Shannon Brown. I am a board member who's a resident of within city limits. And I've been on the board since last summer. So just coming up on a year in the next couple of months.
Thanks, Shannon. Kelly.
I'm Kelly Harris. I represent the citizens of East Helena, and I think I've been on the board for 2-3 years, something like that.
Thanks, Kelly. Any other people that are not guests? There's Janice.
She is staff.
Staff. Okay, good. Great. Okay, I think we got everybody. Thanks for that.
Yeah.
Okay, so we'll just get right into our agenda then, which is to review any additions or changes to the agenda. Besides our introductions, which is a nice add. Seeing none, we can go ahead and move into the minutes. And as you review the minutes, this is the first time we've had the minutes presented in this format. So let us know how it goes over. It's page 4 of 15 of your packets. This goes along with this whole new structure of trying to coordinate the work of the board with the greater strategic plan of the health department and help us kind of really see where our work fits into supporting those actions.
And that format follows along with the agenda, so it helps it.
Yeah,
Yeah.
it was nice.
So I didn't, on the last page, I did not make it to the training that was in town, which I was sad about. It's on the very last paragraph.
Is that an edit? Is that a correction you made to the minute?
I was supposed to go and I didn't, so it said I will be attending, so I
Thanks
just
for
thought
that.
I'd clarify that.
I don't think the minutes need to be amended, however, because at the time of the meeting, that was the intention. So
Yeah.
we can capture in our current minutes, however, if that's needed.
Any other changes or additions? Okay, hearing none, minutes are approved. And we can move right into our introductions of new staff and employee recognition. And I know we got to meet you, but we'd love to hear a little bit about you from whoever's introducing you.
Haley Bratke again. I am a mom of 6, with over a decade of breastfeeding experience myself. I am a certified birth doula. I have a bachelor's in psychology with a minor in biology, and I am currently finishing my master's in mental health counseling. Again, just really excited to be here. It aligns with everything
Awesome.
I love.
Yay, welcome.
Thank you.
And I will introduce Jordan, as she already introduced herself with her name, but Jordan has jumped in and started undertaking the task of billing for public health, which involves a lot. So go ahead, Jordan.
Yeah. I used to be a high school English teacher, so this is a big change, a lot of learning. But it's been good. Yeah. Like I said, glad to be here.
Right on. Welcome to the County Health Department.
And Madam Chair, we on the agenda, we did have Steve Tennis, who was going to be here. He has been detained in East Helena doing his work as environmental specialist doing the lead testing. So we will introduce him next time.
Okay, that sounds good. Thanks for the introductions and welcome again. It's a great team you guys have joined, so we're glad to have you. Moving into our next agenda item, board training. We will hear from Brenda, I'm thinking.
Yeah, great. Thank you, Madam Chair, members of the board. Just to circle back to new employee introductions, and we typically would do our quarterly recognition for our employees. We do a internal process of nominating and selecting employees who have gone above and beyond in their work. We received a very large number of nominations and have not had an opportunity to make a selection. So we'll have to save that one for next month as well. That'll be a fun add to our May meeting. So
that is awesome.
Yeah,
Brenda, I was
great.
just wondering if I could steal a little time back just with the universal home visiting thing, just because it's so kind of cool.
Yeah.
I just want to say that like the home visiting services have evolved so much over time, and the fact that we have a position for universal home visiting, like I'm gonna cry, like it's huge. And I'm so happy you're here. And it's like really kind of cool timing because it's something that I shepherded for a long time too. And I don't know why it makes me emotional because it's just a success.
Yeah.
It's such a big win that all moms and dads and families can have a support person come to them and truly like connect with them in their space and really, deliver what they need in that time. And the fact that it's supported, is just awesome. So I just had to say that because it actually really needs to be said. I think it's public health. I mean, investing in moms and babies in the first few years is the ultimate investment, if you ask me. I mean, what we do in those pregnancy and the first few years, like it's generations of impact. So, yeah, it's just a celebration. We really need to be happy about that with all that's happening. Like this is a big win and I'm so happy to hear about it. Yeah,
a good positive thing. And it's an opportunity to meet people where they're at and be able to provide. It's wonderful.
Mhm.
And Haley's smile makes that nice.
Yeah. So yay. Okay. Back to you. Thank you.
Yeah, it's always, I'm glad that we took the time to celebrate that because like you said, Bree, it's been a long time coming and a lot of hard work put into making that a reality. And it is part of the work that you did when you were with the health department many years ago. So I'm glad that you stopped us and
I had
took a minute-
to.
took a minute to
No, I
celebrate
cried.
that. Yeah, yeah. So moving into our board training, I moved this to the top of the agenda rather than at the bottom, like it has been the last few months, because today's training sets the stage nicely for discussions about Q3 financials, as well as discussion around the preliminary fiscal year 26 budget. This is a module that those of you that have been with the health department or been with the Board of Health now for several years, you've seen this. But I do think that it's a really nice foundational training module that is put together by the University of Michigan in collaboration with the National Association of Local Boards of Health, NALBO. They have provided some really great training modules around governance and those foundational governance elements that you all have been kind of assessing and keeping track of and training on now. And so I hope that this works, because I am not seeing where it's letting me share sound. And so this may cause a problem. And if it does, then we'll just shut it off and we'll go at this a different way. But I will give it a try and see if we're able to get it to work here. So did you hear that?
We did not.
No. Okay.
Let me just see if I can poke around and see anything. Advanced
Yeah.
sharing options.
It's
Multiple panels can host. I don't see anything about volume or.
see if there's something that says permission to share sound, because I see it here, but it's not letting me select it.
Sarah, by all means, if you find it before I do, please. Wait, let me see.
Go maybe over to the audio.
Audio settings, so that's a speaker. Audio
So Sandy, are
settings.
you sharing your screen for what was just shown?
No, I am.
Oh, Brenda, when you press share,
Yeah,
you didn't see the share sound option?
I see the share sound option, but it's not letting me select it.
Oh.
It's like my permission is not turned on to share my sound. So I think it's a setting somewhere. Sorry, I should have jumped on sooner and tested our technology before we got started.
Let me just see here.
Could you make Brenda a co-host? Sometimes that changes permissions.
That's a great suggestion. Thank you. Brenda, I will try to make you a co-host and see if that makes a difference.
Okay.
I'll go into Zoom. Sometimes it's how we set up the meeting. So I'll go into the Zoom platform itself too and try it from back end.
Thank you, Sarah.
Yeah, it's still not letting me share my sound.
What could this setting be? I wonder if it's because I have multiple participants can share simultaneously.
It shouldn't be.
Okay. Let me just go back over here and see if I see anything that.
I like using this module because they just do such a nice job of outlining the roles and responsibilities the board has in the financing of the department. And I just appreciate the way they approach the conversation. So I was hoping that we could do it.
Is there a link you could chat and then we could stream it from this side?
Mm-hmm. Stop video. She's not muted.
We can try that, but I'm logged in into course. So
Oh, it's on a course.
yeah.
Uh-huh.
There's the link, Sandy. See if you
Okay.
can-
Where's a 15-year-old when you need them?
I know.
Okay, Sarah, while I am trying to log in there, can you look there should be a spot that says share computer sound.
Yeah, I think I'm getting closer on the back end because there has to be.
Yeah, I don't.
Thanks everyone for your patience.
So let me go back here. Let's look up.
You just need to have next or what?
Hello and welcome on behalf of the Region 5 Public Health Training Center. This course was
Brenda,
Yes,
are you able to hear that?
I can hear it. Yeah.
Okay.
We can hear it.
So are you able to select the finance module? I don't want to, it's a full,
Public
Yep.
health.
yeah. So select the financing public health module and
Mhm.
share your screen.
Okay. Go back here. Whoops. Share my screen. Come on. Here we are. Okay. Go ahead. All right.
In this module, we will explore the role of boards of health as stewards of public health resources. We will also identify the importance of funding for boards of health and for public health in general. Finally, we will discuss various sources of funding and the best way to access them.
Well, then you have to hit next.
Oh, we have to hit next. Okay.
Let's start by looking at the role of boards of health as stewards of public health resources. It is important to understand how boards of health can support public health agencies in the best use of the available resources. What does it mean to be a steward? In this context, it means not only being knowledgeable about your health department's budget, but also ongoing engagement with your local health official. It means taking into account what the leadership hopes to accomplish and ensuring sufficient funds to address priority issues. According to the National Association of Local Boards of Health, or NALBO, resource stewardship is assuring the availability of adequate resources to perform essential public health services. Developing and approving a budget that meets the needs of the community and the requirements of the health department includes long-range fiscal planning. Sometimes budgets require maintenance of effort for state dollars, cost sharing from the general fund, or spending in accordance with grant requirements or restrictions. Budgeting may also involve revenue generation. If applicable, the Board of Health must make sure that fees for services are in alignment with other jurisdictions and are fair and reasonable considering the populations being served. Ultimately, it is important to remember that the Board of Health has been entrusted with funds to support the community and must take care when using those funds. In addition to budgeting, NALBO suggests that key components of resource stewardship for boards of health may include ensuring that adequate facilities and legal resources are available to support public health in the community, It may also mean developing agreements with neighboring governing entities to share resources. Several states have guidebooks available for local boards of health that illustrate their role as resource stewards. For example, the Indiana Local Boards of Health Orientation Manual outlines the board's role in setting conditions and standards for all funds solicited in the health department's name, engaging in sound, long-range financial planning, approving budgets, and establishing policies and procedures for financial spending. Check with your state health department or state association of local boards of health for a similar guidebook available for local boards of health in your state. With this understanding of the roles of boards of health as resource stewards, let's look at ways that boards of health may support health departments in securing adequate financial resources to best perform their essential services. Sufficient funding allows public health agencies to promote information pertaining to new policies and to disseminate best practices. It also allows them to collaborate with other organizations on programs to improve population health. Before describing the role of boards of health in financing such programs, let's explore public health financing in general. State health departments receive their funds from multiple sources, with variation from state to state in the proportion of funding received from a given source. As you see on the screen now, state health departments generally receive about 50% of their funding from the federal government. This tends to come in the form of grants, cooperative agreements, contracts, and allocations. About 24% of state public health funds come from state taxes, and the rest may come from fees, Medicaid and Medicare, or other revenue. Local health department funding is funneled from state and federal sources through state agencies. Local jurisdictions also provide funding for programs. If the local agency is a unit of a larger state agency, funding from the area served plays a smaller role. Local health departments and their boards of health may also depend on funding from private grants and foundations, collaborative and project-specific grants, and jurisdiction-based funding. Federal funds for state and local public health agencies typically come from the U.S. Department of Health and Human Services and its agencies, such as those listed here. Let's look at Ohio as an example of public health funding. In Ohio, governmental public health is supported by a combination of federal, state, and local funding sources. In fiscal year 2012, 70% of the Ohio Department of Health's funding came from federal sources, with the remaining funds coming from the state. 65% of the federal funds were passed on to local health departments, businesses, and other organizations or programs like WIC or Children with Medical Handicaps. About 75% of local health department funding in Ohio comes from local sources, such as local government, general revenue and mileage, or local fees, and contracts to provide environmental health services. Let's look at how Illinois established funding for local health services. In Illinois, health departments and their governing boards of health can be established at the city level, county level, and also at a bi-county or multi-county level. Local boards of health have different options for providing funding to local health departments, such as county's general fund or tax revenue. It is important to note that in Illinois, while it does not matter what method is used to provide local support, the Board of Health reports to the appropriate governing board, which has full budgetary approval authority. Unfortunately, the public health system has been chronically underfunded for decades. Expert analysis have found that limited public health funding has severely impacted the ability for federal, state, and local entities to adequately carry out many core functions, including programs to prevent disease and prepare for health emergencies. A study conducted by Dr. Glenn Mays at the University of Kentucky in 2013 illustrates the importance of adequate funding for population health. Dr. Mays found that increases in public health spending are associated with decreases in infant mortality and non-infant deaths from cardiovascular disease, diabetes, cancer, and influenza. These improved health outcomes were seen in communities that targeted spending on low-income areas or that allocated their public health funding across a wider range of preventative services. In an article by the Robert Wood Johnson Foundation, Dr. Mays suggests that the results clearly show that better health and lower healthcare costs are possible if we simply change how and where we allocate public health funding, even if new money isn't available. He continues on to say, it also shows that new resources such as funding from the Affordable Care Act's Prevention Fund can have a larger impact if targeted to lower resource, higher need communities, and if spread across a range of prevention strategies. A Board of Health can play an active role in obtaining and making decisions about how to allocate funds within their jurisdiction to best support population health outcomes. While it is health departments that usually apply for grants, a Board of Health can also be a grant seeker. Additionally, a Board of Health may be asked to support, review, or provide oversight for the local health department's grant application. Boards of Health can and should be involved in discussions when health departments seek funding from outside resources, as they can provide necessary letters of support, convene funders, or make connections between partners to support a program. If you are writing or reviewing a grant proposal, please see the resources section for a few grant writing resources. Boards of Health can help their state or local health department make the best argument for obtaining funding by supporting them and emphasizing several key elements in their proposals. Healthy People 2030, a program of the U.S. Department of Health and Human Services, outlines several steps for locating sources for and securing funding. The first step to acquiring funding is to get the necessary data to demonstrate a need for financial and programmatic resources. Use data sources like the County Health Rankings and Roadmaps or the CDC's Behavioral Risk Factor Surveillance System. You might also become familiar with other local surveillance resources to find specific information about your community. Next, see how your city or state compares to national baseline data using a data source like Healthy People 2030. The second step when considering funding opportunities is to align your local health goals with national initiatives. For example, if you are interested in obesity-related funding opportunities, you could tie your local efforts to national obesity campaigns conducted by organizations like the Centers for Disease Control and Prevention or the American Heart Association. It is also important to identify new stakeholders and partners by making connections with experts in other communities and states. Finally, use evidence-based information to plan a strong public health program. This will ensure the best possible use of limited resources by focusing on implementing strategies that have been proven to work to promote health. There are federal, state, foundation, and national association sources of funding for public health. Let's look at a few of those sources. Grants.gov is a centralized location for grant seekers to find and apply for federal funding opportunities. The site provides access to 26 federal grant-making agencies, such as those shown here. You can learn more by going to www.grants.gov. In addition to federal funding, each state may also have funding opportunities available. For example, Hawaii, which ranked first in the nation for per capita public health state funding in 2012, awards grant funds to nonprofit organizations to support health-related programs. The Minnesota Department of Health provides grants and loans to eligible applicants, including, but not limited to, community-based organizations, community health boards, hospitals, school districts, local public health, and tribes. A July 2014 example of a state-funded opportunity was the Comprehensive Supportive Services for Safe Harbor, No Wrong Door, in which applicants provide support services to sexually exploited youth. You should visit your state health department's website to discover what funding opportunities are available. There are many foundations that have funding focused on national, regional, or local initiatives. The Robert Wood Johnson Foundation is just one example of foundation funding, and it provides grants for projects that advance the foundation's mission to improve the health and healthcare of all Americans. The foundation has also provided grants to advance accreditation and support quality improvement in local health departments. In general, organizations eligible for Robert Wood Johnson Foundation grants are public agencies, universities, and 501c3 public charities. You can learn more by going to www.rwjf.org/grants. There are also many national associations that offer public health funding opportunities. One example is the National Association of County and City Health Officials, or NACCHO. NACCHO funds local public health initiatives and provides a list of funding opportunities on their website. An example from August 2014 was NACCHO's funding opportunities for health impact assessment, which provided approximately 3 awards of up to $15,000 each to local health departments to complete a health impact assessment. You can learn more by going to www.nabho.org/topics/funding.
Now that we have explored all of the module objectives, let's look at an example of what an effective Board of Health can do for its community as a resource steward. The following example is just one of many possible examples from various settings across the country of a Board of Health success. Franklin County Public Health in Ohio is the 6th largest health district in the state, serving more than 430,000 people in 17 townships, 14 cities, and 9 villages. The health district is governed by the Franklin County Board of Health, a 5-member board appointed by the District Advisory Council. The health department provides public health services, plumbing inspection, and enforcement of public health regulations to the Franklin County townships, cities, and villages, each of which pays the health department for those services. The Board of Health is responsible for setting and approving the health department's budget. This includes approving any rate increases the health department charges for the services it provides. In 2011 and 2012, there were no increases in the per capita rate. In 2013 and 2014, the board approved a 3% increase for services provided, which was a per capita rate of $6.11. The Board of Health approved a per capita increase of $2, almost a 33% increase, in its August 12, 2014 meeting. By negotiating and approving increases in per capita rates to support the health department's budget and activities, the Board of Health is acting as a resource steward and ensuring resources are available to meet the community's needs.
Great, thanks, Sandy, for helping to troubleshoot through that. I think, though, one of the things that I really appreciate about how they approach that material is they connect the budget back to community need and strategic planning, which we also attempt to do within the health department. Each year we look at not only how we've been funded previously and how our spending has occurred previously, but what our strategic initiatives are that the Board of Health has set, and what the strategies are that are outlined in our strategic plan. And we look for ways to then fund that work, so that we make sure that the funding that the health department is using is going directly to the greatest needs. We know that there isn't an unlimited amount of resources, and so we need to make sure that the resources that we do have is directed toward the greatest needs. And so that is how we try to approach the budgeting process every year. And then, of course, being good stewards of the funds that we do receive, and managing and monitoring our budgets throughout the year, which we will be doing both of those today and in the rest of the board meeting, where we'll go over the Q3 financials for current fiscal year 25, and then look briefly at the preliminary budget for fiscal year 26. The other thing that I will just add to the material that was presented in the video is that in the state of Montana, there is no general funds that is directed to local public health. Many states invest in public health through their general funds that are the taxes that are collected. But in the state of Montana, there is no general funds. So our funds come primarily from the federal government that pass through the state. And then there's a couple special revenue funds at the state level. So tobacco is a really good example of that, where there was the tobacco trust. And then those funds then are used to do tobacco prevention work at the local level. So that's just, I wanted to make sure I pointed out that that difference in the state of Montana versus some of the other states that they mentioned. Any questions that I can answer for you on the training module? Great. Well, thank you again for your patience as we worked through that, and I'm glad that we were able to get it done.
Thanks, Brenda. Okay, any discussion?
Yeah, I'm just trying to clarify. So my understanding is the commission is the one that is about the funding, right?
The oversight of the budget is through the county commission, yes.
Yeah, but we help with strategic planning. Is that what you're saying, more or less?
So the process is we develop the public health budget within. So Heather and our leadership staff, we develop the budget, and we develop a budget that is connected to the strategic initiatives and the work that is by law required for us to do. The Board of Health will, you'll look at the preliminary budget today, and then in May, the final budget will come to you. And at that time, it will be an action item. And the action that the Board of Health will take is recommend for approval to the county commission. And so then I will take the budget as well as the approval from the Board of Health to commission at a hearing, a public hearing that happens at the very end of May. And I will present the budget to the county commission for their final approval.
Okay.
The other thing of note, as far as revenue is concerned, is that we do our staff within the health department do the work of researching potential grants that will help to support the work that we're doing. Those grant applications go before commission for approval before the grant gets applied for. And then if we are funded, if we're selected and funded, the county commission also approves the receipt of those grant funds. And so anything funding related is essentially directed by the county commission.
Yeah.
Thanks for the clarifier.
Yeah.
Yeah.
That helps a lot.
Great.
Yeah. Thank you, Brenda.
Yeah, absolutely.
Anything else? Okay. Okay. Thanks for the training, Brenda. Always good to have. And we are on to the quarterly finance report.
Or you want to do it?
I can share from here if that's helpful.
Okay.
And so I'm not sure what page in the packet. Oh, it's page 9. 15 in the packet is Q3 of our financials for our current fiscal year 25. And so on this sheet, what you will see first is our revenue that was budgeted at the beginning of fiscal year 25. And then what revenue we have collected over the first 3 quarters of the fiscal year. And essentially where we're sitting as far as percentage wise. And so this percentage up here shows that we're 75% of the way through the fiscal year. And then this percentage here shows that we have collected 55% of our expected revenue. This is very typical this time of year because our tax assessments and the taxes that are collected to support the operations of the health department are collected in November and May. So we've received the first installation of those tax assessments, but not the second. And that's a good chunk of the revenue that we receive. And so the rest of the categories you can see there, it breaks it down for you, you know, as far as how we're doing as far as collecting the revenue that we anticipated that we would collect at the beginning. So any questions on revenue?
I have one. So the taxes the money that you get doesn't come through the general fund. Where does it come from for the state?
So the taxes that we receive are county taxes. So the health department receives mill dollars, which are property tax dollars that are collected at the county level. And then what you see here is what's anticipated. And we get this number from county finance. They calculate what we anticipate for revenue based on the properties in the county. And then those funds then are collected at the county level and distributed to the departments within the county.
And Brenda, can you confirm that we get no general fund dollars from the state? I think that was the question.
Yeah.
That's correct. No general fund dollars from the state. The funds that we do get from the state are grant dollars that most of them are federal grant dollars that flow through the state to the department. That those are represented on this sheet down here under grants and contracts.
Yeah.
Yep.
Is there a percentage of the county taxes that are collected that you can always count on, or how do you guys get that?
Yeah, there is a specific health mill. So if you were to look at your tax statement that comes to you, it will specifically indicate how much taxes you pay as a property owner that goes to health. And those are the funds that then come directly to the health department for the work that we do.
Okay, thank you.
Yeah.
Question on one, the health insurance credits, where, can you explain that one?
Yes, and Heather can probably do a better job than I do, but there is a permissive levy that covers health insurance for county employees. This is the amount of that overall permissive levy that the health department receives to cover the employer contribution of employee health benefits. How'd I do, Heather?
You did great.
She's a good teacher. Looks like Shannon has a question.
Madam Chair, thank you. Trenta, do you have, not right now, obviously, but do you have like a breakdown of revenue sources by, obviously this is sort of like the source of the funding from like a qualitative perspective, but like the, whether it's like federal, state, private, like broken down that way, sort of like the organization funding or the entity funding. Do you have that?
We do kind of in general, but it wouldn't be hard for us to put together in more detail, and certainly can provide that during the May budget presentation that we do. But what I would say is that about 70–75% of, nope, I'm going to pause there for a second. We did this last year, and so now I'm trying to recall the percentages. It's over half of our overall budget, over half of the revenue for our budget is grants. And most of those grants are federal grants. And then the rest of the pie, you know, if we're breaking it down in a pie chart, the next largest amount of revenue is going to come from those taxes that we collect. And then fees for service and things like that then are a smaller piece of the pie. Heather, do you have off the top of your head a better breakdown of?
No, not off the top of my head, no.
Yeah, we can do it because we have all of the details of every piece of revenue that comes into the health department. So we can certainly put that together in more detail. But in general, that's about how our revenue gets broke down is just over half our grants, and then taxes, and then fees for service.
Thank you. And the reason I ask is not, again, I don't think this is something we really need to discuss now, but I do think as a board, it's important probably to be aware of the status of federal grant funding. I have a lot of friends in public health research who have recently had their funding eliminated or paused or whatever, and I don't know if that's, going to happen at like the local level, but I do think we should probably know, like what percentage of our budget is coming from federal funding, and sort of at least be aware of maybe potential other revenue sources that could supplement that. But again, I don't think that's a question for now. I was just curious since we're going over this today.
Yeah, and we're tracking all of that very closely because it is the amount of money that our local health department receives from the federal government is significant. And if we were to lose any of that federal funding, it would result in reduction in staff and elimination of programs. That's bottom line, because there are no other funding sources that is supporting the work of the health department. And that could backfill if the federal government chose not to fund us in the way that we are being funded. So we are watching all of that very closely and waiting for information to come. We were very nervous when there was an executive order that put a freeze on federal funding and grants coming to states and local agencies, and that would have been very, very detrimental to the health department if that were to happen. We were really grateful that the courts put a Shannon, what's the word I'm looking for?
Injunction.
Injunction on that executive order, so that funding at this point is not impacted, but we do anticipate impacts to funding moving forward. And so we're just waiting for details to come, waiting for a better understanding of what it is that will be impacted. And then we will have to make adjustments from there. What I'm really concerned about is that there are no obvious revenue sources that can backfill if we were to lose federal funding. It's significant.
Thank you. I really appreciate your answer to that and your thoughts on sort of there is no alternative really. But I'm glad, I'm glad to know you're tracking it and that it's something that is on the radar.
Okay, I'm going to scroll down and this is expenditures in a summary format. And so again, 75% of the way through the current fiscal year, and this shows personnel expenses that have been spent at 69%. So we're underspending our budget slightly overall in personnel. The next page we'll talk about operational expenses. Any questions on personnel expenses?
One question, other question, if you take a look at contracts and grants, we show, do I read that right, that we show that we're only recognizing 2% of that?
So go ahead, Heather, I'm going to let you.
I can take care of it. We got a very large immunization contract that the county finance office asked me to pull out of our mill and put into a separate fund. So it is recognized here as budgeted, but it is not actually shown in here because it's in a separate fund by itself.
Okay, so, but does it show?
There's no expenses in here. There's nothing related to it showing in any of these.
Okay, so, all right. Yeah. And one of the frustrations that I see is for quite a bit of the year, we put in bills to the federal and state grants, and we get paid, but we don't officially get the grant awarded. In fact, we just approved a grant award this morning that we have been paying out and receiving money on all fiscal year. But it didn't actually become official until we accepted this morning.
And you had the money or didn't have the money?
We were getting it. We were getting the money and
Happens all the time.
yeah, and that's very typical in health funding and more so than any other kind of funding we do.
Wow.
Yeah.
It is a frustration of ours too, Commissioner Wolf.
Yeah, absolutely.
It's hard.
It's gotta be, it gotta make your work, quite a bit harder. Just every once in a while you get out the genie lamp and say, what's gonna happen here?
Yeah. Well, we'll be getting, once we get through fiscal year 25, quarter 3 financials, we're going to get out our genie lamp and talk about fiscal year 26. Because there's a lot of guessing games that are happening. Okay, so if I scroll to page 10 of your packet, it's probably hard to see on your screen. So if you have it in front of you, it's probably much easier. I'll try to increase the size of it so you can see it a little better. So this page represents all of our operational expenses. So everything from supplies to lab expenses, printing, training, professional development, travel, and so forth. And those are all the details are broke down on the left-hand side. The first column represents how we budgeted for the year. And then this column over here where it says percentage of budget spent will show you how we're doing as far as spending as it relates back to the budget. And so as I scroll down to the bottom, you can see that 75% of the way through the year, we are spending at 82%. Most of that has to do with the fact that and I think I explained this when we were halfway through the year, that immunizations, for example, we make huge purchases early in the year. And so that expense sets at 100% for the rest of the fiscal year. And so it kind of skews the look of how we're spending, but we are spending right on how we anticipated spending for the most part. And then as I scroll down, you can see that we have, I'm trying to find our cash balance right here, ending cash balance as of the end of the third quarter, and our 90-day reserve. We're sitting at 99 days, so we're above where we want to be as far as having cash reserve, which is in a much healthier place than what we've been in the last couple of years. We've really struggled to have our 90-day reserve, and right now we are looking really good. So spending on track as planned, and our cash reserves look good. Heather, what would you add? What did I miss?
We're looking good.
Yeah.
We're keeping it together.
Yeah. We're spending conservatively, knowing that we still have budget challenges. So we still have issues with our expenses growing faster than our revenue, and spending conservatively, knowing that we're not sure what our future funding might look like as far as federal grants are concerned.
Madam Chair, Drenda, do you, or I guess whomever has the information, I'm just curious. So obviously quite a challenge if expenditures are outpacing revenues. Are there particular kind of areas where you're seeing unpredictability? And do you think those are in essential services, or just things that we do have a budget for? It's just we didn't budget it. Like, I guess, what's your read on that?
Yeah, it's so as I tried to explain, a good chunk of our revenue coming in are those property taxes, and the property taxes are not growing at the inflationary rate that our expenses are growing. So that's one of the biggest reasons. We are a part of a really incredible county that chooses to take care of staff. And so they have done really nice cost of living increases to try to keep up with inflation, but the revenue is not. And so we have seen kind of that pinch happening the last couple of years. The budget that I'm getting, the preliminary budget that I'm getting ready to show you, it still has some evidence of that, but it's leveling off as far as those really high or sharp increases in expenses that we were seeing the last several years. The last 3 years have been pretty significant, and we're starting to see them level off a little bit now. But our fixed expenses are the greatest amount of our overall expenses. So if fixed expenses include our personnel, our building maintenance assessment, so the building that we reside in, we pay for that space, and then IT expenses, those are all considered fixed expenses. And they take up a pretty large portion of our budget, and those are fixed, which means we don't have control over them.
Thank you.
Yeah. Okay. So that was the review of our Q3 financials. And if there are no further questions on those, we can dive into the budget for fiscal year 26.
Board members, do you have any questions? Let's go for it.
All right, here we go. I did have an opportunity to meet with both Bree and Rex earlier this week. And so as the board finance committee, I guess is what we could call it, they had an opportunity to look at this preliminary budget and ask some questions, and we got into the weeds a little bit. And so we can certainly talk through some of that as we go through the budget documents. These documents were emailed to you yesterday, and so you may not have had an opportunity to look very closely at them. So we'll go through them and answer questions as we go. We are going to start with, sorry, just looking them over before our meeting and didn't start at the top. Okay, so the first page is the budget summary for all three portions of our budget. And so some of you may remember from last year, this is a new format that we're using to present the budget. And our budget is presented in three distinct pieces. I'll show you a budget that's specific to the tax revenue that we get. So our health mill dollars and how those are going to be budgeted. I will show you another budget that's specific to grants and how those are budgeted. And then our Water Quality Protection District has a separate and distinct budget as well, because their board does something very similar to what you all do, in that they look at the budget, they recommend for approval, and then it will come to you in May and then go to the Board of Health or Board of County Commission. And so it's important that we represent those three kind of pieces of our budget. But this first page is a summary of all of those combined together. And so it has for you our fiscal year 24 actual, how we actually spent the budget in fiscal year 24. It has for you our fiscal year 25 budget, what our actual is at this point in the fiscal year. So we haven't completed fiscal year 25. So this is only 75% of the way through the year. And then what we anticipate the fiscal year 26 budget to look like. And so the revenues are represented in green, and we have a variety of different types of revenue, which are listed in the column to the left. Different types of revenue. Again, a good chunk comes from our tax assessments, that 1.7 million, And then the intergovernmental revenues, that represents what we anticipate for grant revenue coming in. Otherwise, the other amounts are fees for service, things like that. And then the expenses, we again are summarizing for you our expenses we anticipate for personnel, operations and maintenance, fixed charges, which include the building and IT, and some other financing uses. And that's adding up to 6.8 million, which is more than the revenues. And we're going to get into the detail of why that is in the next couple pages. But in summary, at this point, this is not the budget that you will see in May when it comes to you. This is preliminary. There are things that we're still trying to work through, especially related to grants. And I'll point those out here shortly. The personnel expenses reflect the county's intention to have a 2.13% cost of living increase again in the new fiscal year. As far as fixed expenses are concerned, our building maintenance is about level. It's about equal to what we were paying in this current fiscal year. So no increase there. And then IT they're actually decreasing the fee that they're charging. So that was really great news. Not often do we have expenses decrease, but because of the work that IT has done to gain efficiencies, and they are doing a lot of work around their capital improvement plan and buying new equipment. The capital improvement plan had been built around more expensive equipment than what they are able to get today. So they're able to save quite a bit of money in that way. And so they're passing that savings down to the departments. So we get to benefit from that. I'm going to start to scroll down now through each of the three pieces of the budget. And so the mill is the first piece of our budget. And so this is just representative of the expenses that are associated with those tax dollars that we receive to do the work that we do. And so what you see here is a total of about $2.6 million in revenue coming in, anticipated revenue coming in for fiscal year 26, and $2.4 million in expenses. So we have a positive balance there for our mill, the mill portion of our budget. Any questions on the mill piece of the budget? This piece looks pretty good. There might be some adjustments made before you get the final, but for the most part, this is looking pretty solid.
Thanks, Trenda.
Yeah. Heather, did I miss anything important for the mill piece?
No.
Okay. So then the next piece of the budget has to do with grants. And so this is where this is our problem child right now, that we're trying to work through the challenges. And so oftentimes at this point, we don't know exactly what grant revenue we will be getting in the new fiscal year. Some state agencies are able to tell us that piece of information, many are not. And so we utilize prior year revenue amounts to build the budget until we know for sure how much money we are getting. We do have a change of at least 2 grants that we know of at this point. Our consolidated chronic disease contract includes funds to manage the Connect referral system. That task order that we get to do that work in the new fiscal year will not include money to support the Connect referral system. So that's a change. The grant itself is not going away, but that portion of the grant is going away from the state. So we're having to, those grant funds we're paying for one half of an FTE. And so we're having to figure out how to reallocate that staff FTE to other funding. And then HIV is another grant that we will not be getting. We have received HIV grant funding for many years in the past, and it went out for bid, and we had to reapply. And we worked with Peerview Health Center to be the applicant of those funds, and we were going to be a partner. And so when we submitted the application, Peerview Health Center was the applicant, and we were just named as a partner in that application. That application was not selected. And so there was another agency in the community that was selected to do the HIV prevention work. And so we know who the agency is, and we'll be working with them moving forward. But it's a grant that we have had directly in the past that now those grant funds are going to another community agency, and we will just partner with them to do the work. Those are the two grants at this point that we know of. We have not received any correspondence from the state or the federal government on any other grants that will have a change to them. I'm going to pause there, though, to make sure that that's a correct statement. Heather or Sarah, are there any other grants that we know of that are changing that we know of at this point?
None that I know of.
And at this point, there's one that we're concerned about, but that's the only one those are the only ones we've heard of so far.
Yeah, and it's a federal grant that comes from a federal agency, and we are I think it's a 3-year grant, and we're 1 year into that 3-year grant, and we're just hoping that we're able to maintain that funding through the duration of its full term. But I'm a little concerned about it at this point, but we're waiting to hear more. It's a grant that lets us do some of our behavioral health work around crisis mobilization and crisis services. So. All right. So grants are causing us a little problem, but from yesterday or 2 days ago, or I guess it was just yesterday morning when I met with Rex and Bree. I don't even know what day it is at this point. This was the spreadsheet that they did see, but then Heather continued to work on it, and this amount down here in the revenues less expenses is now down to about $200,000. And so that's good news. We are able to make some adjustments and get some more information plugged in. We also know that there will be a negative balance for the grants portion of our budget, but we also have prior year funding, grant funding, that will be able to help balance the budget. So we received 2 large amounts for immunization services in the last 2 years, and those large amounts were given to us, but not given to us in a way that required us to spend them in the same fiscal year. So we were able to carry them over into the next fiscal year. And so fiscal year 24, we had a good chunk left over that didn't get spent, and into fiscal year 25. And then again, from fiscal year 25, there will be another pretty good chunk that is left to carry over into the new fiscal year. Again, immunization services related, and that those funds, those grant funds that we have a balance, will be used to balance this budget. So when we bring the final budget to you in May, it will show that detail. It will show the balance that we have, the cash balance that we have in our grants, and what amount of that is going to be spent to balance for fiscal year 26. That carryover amount. Does that make sense?
Yes.
Okay.
Mhm. Does that make sense, sir? Non-grant people?
Mhm.
Okay, great. Thanks, Brenda.
Yeah. Any questions on the grant portion of the budget?
Not seeing any.
All right, I'm going to scroll to the last piece, which is our Water Quality Protection District budget. Again, they have their own tax assessment, property tax assessment for residents that live within the district boundaries. That is not the full county. So it's just those properties that are within the boundaries of the district that get assessed this tax. And those are the funds that, the only funds really, essentially. They do have very minimal grant dollars that support some of the projects that they do. But as far as just operations of the district, it comes from those assessed fees, which is this amount here, the $389,000. And so what you see is that we have revenues projected or anticipated at $416,000, and then expenses are projected at $483,000, which is a negative balance. You can see where Heather has put in their ending cash balance. They have a very healthy cash balance. It's way over the 90-day reserve, and the district board has really encouraged the staff within the district to spend those funds down to that 90-day reserve. And so that's what you're seeing here. That's what you're seeing happen is that $67,000 will come out of the cash reserve that's sitting there that's over the 90 days. So their budget is very healthy and no issues here. They've had some staff turnover in the last couple of years, which has contributed to that cash balance that they're holding. So there's some vacancy savings that have caused a little bit issue there. And Bree, you sat on the Water Quality Protection District Board as the Board of Health representative. Was there anything from the district board meeting on Tuesday that you would add that might be helpful?
I don't think so. I think you covered it, the high level stuff, just that they had some staffing vacancy savings, I think was a big part of it. And I can't remember, but there's this large funding source that over several years they've been spending down that they're almost done with. I think is good. So, yeah.
Okay. And then I'll just ask Bree and Rex from our conversations yesterday morning when we looked at the budget, was there anything more that you all wanted to either reiterate or clarify?
I don't think so. Brenda, Rex here. You learn more the second time around. I think I would just compliment you all on the format and how it's laid out. It's really easy to follow through. So appreciate the effort that you put into it. Around grants, even in my world in school, that we just were informed that we're probably 20% reduction in our title programs. It's just that it's so uncertain right now. So kind of buckle in and keep the reserves when you can. So you're just not real sure what's going to happen here in the near future. But it's really good work. Appreciate the effort. And I'm thankful that we got a chance to go through it again yesterday.
I guess I would just, thanks, Rex. I would just add that you and your leadership in the health department has made huge strides to not find ourselves in a place where we were at this time last year with several $100,000 needed to make the budget balance. So I know that was really hard, and I hope that this year it's much smoother. And it's just so unfortunate that now there's so much uncertainty at the federal level. I was really hoping we could slide into next year without a whole lot of stress. So thanks for keeping going and the good work. And you know, all the sacrifices and creative forming and formatting that everybody's done to make it all work. It's noted and seen, so thank you.
Yeah.
Everyone should know that the staff at the financing staff at the county has been very positive about the great job that Trenda and the finance staff here have done to try to bring the budget into control.
Right.
Yeah,
Good
they've done a great job.
This budget, thank you. This budget also reflects the reorganization that is happening. So we are moving, well, so I'll just go back a couple of years. We had 3 divisions and 3 division administrators, and Kathy retired as our environmental health administrator. And when she retired, we consolidated disease control and environmental health together and had 2 divisions. And then Laurel retired this year, and she was the administrator for that combined division. And so when she announced her retirement, we started thinking about how we can structure the department and to ensure that programs and staff are still receiving the necessary leadership and support that they need, resources that they need. But at the same time, maybe look at ways to lighten the top of the organizational chart. And so we have done that. We are in the process of transitioning to an operations manager that in place of the 3 divisions or the 2 divisions that we have now. And that operations manager will supervise the 6 program supervisors who then are supervising the incredible staff within each of those programs. What I am hoping will occur it won't this year, but I'm hoping it will into the next year, is that it is providing opportunity to build capacity, staffing capacity at the program level. We need another sanitarian at the very least. We need more than that, but I think that's been the one position that is definitely identified as our sanitarians, both in licensed establishment and in environmental health, are a significant shortfall, and the workload is way over what their staffing capacity can hold. And so they're doing the best that they can with our staff that we currently have, but that is an identified need that we need to work towards, is hiring another sanitarian. So lightening the top of the organizational chart will hopefully in the future allow us to do that. Before we make a decision about hiring another sanitarian, I'm waiting for the legislature to finish their work. House Bill 853 is the bill that has been presented proposing increased fees for licensed establishment. And that bill is still alive. Barely, but it is still alive. It is currently sitting in the Senate Finance and Claims Committee after it passed the second reading, barely passed the second reading on the Senate side. It's a little bit of a surprise because it flew through the House, flew through the committee and the House floor so easily. No opposition, really great support. And it ran into some challenges on the Senate side where it didn't pass out of committee. It had to be blasted out of committee onto the Senate floor. And then on the Senate floor, it failed second reading and then concurred. Well, maybe it failed for, I guess I don't know how I'm reading this. Second reading motion to amend failed, and then the second reading concurred, barely. And so it's holding on. There's still hope that that bill will make it all the way through and be signed into law, which would increase fees for licensed establishments. And so that would then provide additional funding to help with another sanitarian. So we're crossing our fingers, holding our breath. The Board of Health did pass a resolution in support of that House Bill 853. That resolution was provided to both the House committee as well as the Senate committee that heard this bill. And there's been a lot of great advocacy work around it. And so at this point, we're just rooting it on as it makes its way through these last couple final steps. So that bill is a contributing factor to our ability to hire another sanitarian in the health department to do the work. So that is all I had for you on the preliminary budget. Please note asterisks and exclamation point. This was preliminary. There's more work that we are doing. There's more information that we need to we're still waiting on the state, for example, to give us more information about grant revenue, some adjustments that we're needing to make. And we'll be doing that between now and your May Board of Health meeting, where we'll bring a final budget for you for consideration.
Well done. Thank you for all the prelim.
Thank you.
Any further discussion from the board or questions? All right. Well, with that, we can go into announcements. Are there any additional announcements?
Madam Chair, I have none.
Okay. Public comment? Okay, seeing none, we are hereby adjourned. Thanks, everybody.
Thank you.
Thank you.